Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, we're back and we have an amazing episode for you today. It's a topic that I think we need to talk about a little bit more as moms and as future moms for some of my listeners who don't have kids yet, just to be prepared. And I have two very special guests, Annalisa, coming back with us.
Hey there, patient advocate 101.
And we have Dr. Nicole Motakef. She's a board certified in general psychiatry, fellow at UCI for child and adolescent psychiatry. And she's invested in integrative psychiatry, which is really interesting. I look forward to hearing more about that. She's opening up her private practice in Southern California in July of 2022, and she'll be taking children, that other word I can't say, and adults. I'm excited for you. And you guys, you know why this is even better that Dr. Nicole joined us? Her husband is actually a plastic surgeon. He's Dr. Motakef out of California. Y'all, I'm sure y'all see him on Instagram. So this is just a really amazing, take. You get to hear from the psychiatry part, what should we be doing? And then you get this extra touch of what's happening in the plastic surgery world. You kind of have a sneak peek. This is going to be amazing. I'm excited. Dr. Nicole, I'm so excited to have you on, and just introduce yourself to us. Let us know what we're going to be talking about today.
Awesome. Yeah, thanks for having me. I'm excited to talk about this. I even brought it up with some of my colleagues just to see what their thoughts were. And it's really not something that we talk about that much. So talking about where the worlds meet between psychiatry and plastic surgery, or even just our appearance.
I'm excited. I did write down a few questions to guide us along the subject. I know I really want you to just give it all to us. Tell us what we really need to be doing.
Give us the business, yes.
So I think the first question is, should I tell my kids that I'm getting plastic surgery? And if I should, how should I tell them?
That's a good question. I guess the first answer is it depends on if you tell them the nature of the surgery you're getting. But I would say it's always important to talk about the fact that you'll be going through some sort of recovery. And of course, that looks different for every surgery. But your kids, no matter how old they are, they'll see that part, unless you're staying somewhere else while you recover. Or they'll notice some change in you depending on where you get the surgery done. So I would say it's important to talk about that part for sure. And what was the second part of your question?
How should we tell them?
I guess starting from a place of checking in with yourself first, asking yourself why you're doing it, because that might be a question that will come up if you tell them what you're doing. Be prepared for them to ask questions and creating an environment that allows them to feel comfortable to ask questions even repeatedly, because our younger kids might just need to have that reassurance. So asking something over and over again might just be a way of reassuring them that things will be okay. But yeah, I guess it really depends on the age of your child or your teenager.
I agree, for sure. 100% age. Mm-hmm.
I could go through different age groups if that's helpful.
That would be amazing.
Yes, for sure.
So I'll even start as young as infancy to early toddlerhood. You don't obviously need to talk about anything because they may not even have the verbal skills. But one important thing is just at that time of development, they really rely on you so much and that connection. So just making sure that you can maintain some level of connection with your baby or your youngster, and have some planned activities that maybe you can't go play sports with them or run around the house with them, but maybe you can do some activities with them still, just to have that connection, and then have someone around to help take care of you and them. Then maybe 3 to 9, this more elementary, preschool, kindergarten age. So they might have more verbal skills and they might have more ability to see that you're going through some kind of recovery. So this is where I still would just talk about preparing them for the recovery phase and not necessarily talk about what you're doing or what you're getting done.
Yeah. And that's important too. Sorry to cut you off, but it's super important to kind of tell them nonchalantly, kind of, mommy's having something done and you can't hug mom at this point, because hugging is a big thing, They still want to hug you. We want them to hug us, So hugging is a big hurdle, I think, for a lot of moms.
Yeah, exactly. I'm finding other ways to connect.
Absolutely.
With talking about that recovery period, you also don't want to necessarily go into too much details of the risks and what happened to you, but maybe just talking about some things to expect, because if they don't know but they see that something's wrong, they obviously can get anxious, but they also, depending on their age, they might blame themselves that something's wrong with you. So they may not have that understanding yet. So preparing them for that.
So that's 3 to 9, right? My daughter falls right there. She's 8 years old. And
that is such a good point.
She is.
You don't want them to spill. Yeah.
No. So let me tell y'all about my daughter a little bit. She's 8 years old and she she wants to know everything that I'm doing, who I'm talking to, where I'm going, how long I'm going to be gone, when I'm going to be back, everything. And for her, when I had my surgery, I really didn't tell them anything other than, I had something on my stomach and I couldn't pick them up. So they could come lay, sit on my lap, or they could lay in the bed with me, but I couldn't grab them. I couldn't pick up my son. He was 1 at the time. I couldn't pick him up, and they were okay. And I feel like now as she's getting older, she's at, like, the other day she asked me, are my boobs going to be big like yours?
Oh.
And I was like, well, yeah, they run in the family. Grandma has had a breast reduction because her breast got too big. I had a breast reduction because my breast got too big. So it might be something that later on we'll have to do if your breasts get too big. But I don't think so. You'll be fine. You got your dad's genes. That's really what I told her.
You're like throwing the ball.
I love that. I think you're preparing her for either way, not making promises, but also just letting her know that it's kind of an open place where she's comfortable talking to you about it.
Well,
that's Tommy.
Yeah.
I want really good. I mean, you're ahead of the curve for sure.
What I wanted to do, and this is kind of the question that I really wanted to ask is, how do I let my daughter know that I'm having surgery? But at the same time, I want her to know that she's absolutely perfect and beautiful and she doesn't need anything, she won't ever need anything like this. But at the same time, if there's something that bothers you, that is constantly bothering you, for example, if you have a nose that you can't stop staring at, like later on, it's okay. We can take care of it. Like, is that wrong that I want her to know that it's okay. We can change it later. Just don't worry about it right now.
How do you bring up the conversation?
Yeah, I mean, I like that it doesn't focus on, because sometimes if we think there's a problem that can't be fixed, it's almost makes a light shine onto it more and you feel more stuck and frustrated with it. So keeping it open, as long as you're comfortable with that. I know some parents might not be, but I think it's a good point where if you want them to know that if they want to later on, they could do that. I think that's a really good way to bring it up, and maybe then she won't worry so much about it now.
So in those age ranges that you were saying, 3 to 9, 9 is probably, that's the younger age range. That's probably a conversation that I should be having with her later, right? So what's the next age group?
The next age group would be like our preteens, so 10 to 12. But some kids, they develop even younger, especially this day and age. Anytime puberty really kicks in, that's when the self-esteem really becomes more of an issue. But before I jump to that, I just wanted to touch back on the 3 to 9 real quick, just because there are a couple more things I wanted to mention that it may also apply as you get older into this preteen stage. But this age group really depends on consistency in schedule. So even if, let's say, you're going through recovery, that you still want to maintain the schedule they normally have as much as possible. And sometimes these kids, they don't want to talk about things that are more serious, but they might express it in other ways like drawing or play. So just giving them that space to do that.
I agree.
And then your question of like 10 to the next age group, 10 to 12, this really is where self-esteem becomes more of an issue. And this is actually something we might touch on later, but this is where even depression and disorders surrounding self-esteem might start originating. Of course, they could happen sooner, but this is really when it's most common to start. So it really is important to have open conversations with your kids about self-esteem in general. And then depending on your opinions on plastic surgery, that could always be something that, as long as you maintain that surgery is a really big decision, it's not the first thing that we go to, but that it may or may not be an option depending on your values, but that it's still a pretty big decision.
Of course.
I like how you work on it, for sure. Absolutely. That's perfect.
So what is something, in that 10 to 12 age range that we as moms could do to help our kids have better self-esteem? I know right now, like with social media and Instagram and TikTok, I see, it's a very slippery slope, even for us as adult women. Yeah. I can only imagine. Yeah. I mean, I tried to limit my daughter's, what she can see and what she can't see, but there's only so much control I can have.
True.
So what is something we can do?
Well, for your self-esteem in general, sometimes if there are things called cognitive distortions. You may have heard of cognitive behavioral therapy or CBT before. And it really highlights something that I think that tends to come of self-esteem issues. We have these automatic negative thoughts. I'm ugly, or no one's probably attracted to me, or things like that. And these are usually traced back to more deeper core issues, or even just an initial, like maybe if you trace it back, like I don't like my nose, but the distortion is I don't have a nice nose, so therefore I'm ugly and no one will like me. So you sort of take it into this distorted version of it just started from, one simple thing that a lot of beautiful people have noses that aren't perfect, or other, I'm just using that as an example, but other physical features. Mm-hmm. And you can also jump the other way of saying, going back to you trace it back to, let's say, maybe it is the nose or some other physical thing. And you can go, instead of going to I'm ugly, you go down the other thought patterns of what could be other ways to look at it, and even positive distortions. You don't want to go down the toxic positivity necessarily, but just what are other ways of looking at this one thing that I'm distorting, only looking at it in a negative way.
Oh my gosh. I'm sorry, y'all. That was so loud. My pregnant dog just ran over my microphone.
Oh no,
it's okay.
It wasn't that loud. You're fine.
It's real life.
It's real life. This is real life happening.
There you go.
Okay. Sorry about that. But
I think those are very, very good points for sure.
And that's really just looking at our thought patterns, but sometimes we see emotions and we don't always have logical thoughts that go with those emotions. So one way of looking at it is like top down, where your thoughts can affect your feelings, but your feelings can also affect your thoughts. And sometimes you
oh my gosh, say that again. That is so perfect. And that goes for every aspect of our life. Please say that again. Mommy, you have to make that into a post.
It's just that our thoughts have a lot of power in changing how we feel, but our feelings also just have a way of affecting how we think. Absolutely. And you just have to feel your feelings sometimes and let it pass. And that's also a way of just, letting yourself have that space to cry or be upset about things, and that's okay.
Right.
That's right. So,
and it's okay, like you said.
It's okay. We all have feelings. So if we are thinking about our preteens, is that the time when like body dysmorphic disorders come in, or does that happen later in their teens, or when does that really happen?
That's the most common age for it to start is around this time in this age group.
In preteen, so that's 10 to 12.
Mm-hmm. Right. And I think the average ages range up to 15, but a lot of times it does start in this preteen phase.
Okay. Now that was preteen. Let's go into the next age group, our teens.
Yeah. As teenagers get older, they might be more perceptive of what you're doing and what surgery you may have. So this is where it might be better to talk to them and be more open about it. Because if you just try to hide it, they might have hard time trusting you or try to catch you. It's a time of they're really separating from their parents while still being dependent on parents. So it can be a difficult time for them in a lot of ways. You don't want to have them catch you in something, but to have that more open conversation, because they can be more antagonistic, though, I would be prepared for them to be against what you're doing, or even be prepared for them wanting some sort of surgery and how you would feel about that. So I guess be more centered with yourself, even and extra prepared before talking to your teenager, because you don't really know which way it may go.
So I think out of the three we've done so far, teens is probably going to be the hardest one, right? I mean, I think.
Yeah.
I'm going through it right now, actually. That's 13. So I'm in it.
Well, in all age groups, and younger kids may do this maybe in a less explicit way, but they can also have their outbursts and their responses. So it might not be, a teenager may be able to have a discussion with you, like, Mom, you shouldn't do this, or, whatever opinion they might have surrounding it. But a child may be they might have more upset stomachs, headaches, fighting, things that don't necessarily have a clear link to what you're doing or your recovery, but it might still be something to keep an eye on. But yeah, definitely teenagers, it might become more of a battle of the logic.
Well said.
Battle of the logic.
Battle of the logic, exactly.
Okay, so what are some benefits and risks when we're talking to our kids about plastic surgery?
Well, I guess the benefit would just be having that open conversation, a safe space for them to now feel like they can talk to you about things they're uncomfortable with. Because a lot of the reason why people are not diagnosed with body dysmorphia or things like that is because people are too embarrassed to talk about it. So being able to have that conversation can lead to maybe an intervention early on if it really is something that's causing a lot of depression, anxiety, or even body dysmorphic disorder. So it does open that door. The potential risk is, this might be for the younger kids, is creating more anxiety about your safety and things like that related to the younger kids who may not know exactly what you're going through, but just see you struggling through the recovery period. And then for older kids, depending on your own values of plastic surgery, they may want it too, which teenagers, as their brain is developing, they may be a little more impulsive about making decisions about surgery or not realizing that risks apply to them too. So they might be a little more hasty to want it and not think as thoroughly through it as an adult might.
Yeah, you guys know I do not want anybody under the age of 18 having any type of plastic surgery. None of
Absolutely.
Dr. Nicole,
yeah.
I'm sure your husband, Dr. Motakef, does not do surgery on girls or boys younger than 18 just because they're too young. They're not ready.
The only reason I would say if you might do it, this is the 1%, is if a patient or a kid has a deformity that they're getting bullied.
Mm-hmm. If it's something like a deformity,
maybe their ears are too big, or they have gynecomastia and they're a football player or something. There's just those certain things where it's not necessarily cosmetic. It's more just to give them
more confidence. I have had that.
That's different. I think that's a whole other field. I don't even know how to say it. It's just you want them to feel confident, but it's not they're asking for reasons that they're doing
cosmetic.
it because they're just doing it because they want to feel confident.
Yeah, I think that's a really good point. That self-affirming procedures are different, and they can be well thought out. And as long as everyone's aware of the risks and all of that, it might have a very positive impact.
That's right. I think there's definitely procedures that can be done under the age of 18. But for example, breast augmentations or, liposuctions with BBLs and none of that I don't think it would be okay for anybody under the age of 18.
I think like autoplasty or gynecomastia
or rhinoplasty
that they can't breathe, so you're going to step though, at the same time. That's different.
And just like we have other self-affirming procedures, like a lot of people have braces or LASIK. And of course, these are not necessarily the same as surgery, but it might be a way of talking about your teenagers that there are a lot of things that we do that are cosmetic that may not be required, but that still can help us feel better about ourselves. And there's always that range of how severe is the thing that we're trying to do to fix this problem, and how bad is the problem.
Yes. And I mean, if you think about it, other patients, they get braces, they get LASIK, other things. We don't deem it as cosmetic, but it's technically, it's cosmetic, right? I mean, if you're fixing your teeth with braces, that's cosmetic.
Right. Our appearance, it really does have a big impact in our life and success and things like that. So it doesn't mean that if you have a distinct feature, it doesn't necessarily mean that you're ugly or things like that, but that it's more of just a way of helping you out. But again, looking at the benefit risk ratio for all of these things.
Absolutely.
So, okay. Now I know we've talked about body dysmorphic disorder, but what is it? Like, actually, can you break it down for us? And what are some signs that we can look out for in our kids or even in ourselves? Because let me tell y'all, it's a very slippery slope once you start getting work done, because then you're like, oh, if I can fix that, I can fix this. And then I can fix this. And before you know it, you have a wish list.
But a good surgeon will tell you no.
Exactly. Well, body dysmorphic disorder, it does have distinct criteria in our diagnostic manuals. I can go through some of those. The first requirement is that there's a preoccupation with one or more perceived defects or flaws in physical appearance. And these might be very slight or not really observable to other people, but to you, they just seem to take on this really important role that you preoccupy yourself with it. And the average preoccupation is about 3 to 8 hours a day. So it's not just in your mind and out briefly, and you look in the mirror and then you go away and you can think of other things. It really is on your mind most of the day. And it's very intrusive. You can't really take it out of your mind. It just is there, and it's hard to get rid of, and it's very distressing. So that's the first criteria. The second is that you have these repetitive behaviors. So mirror checking, skin picking, reassurance seeking, this taking up a lot of your time, spending a lot of time comparing yourself to other people. And the next criteria is that it causes a lot of distress and impairment in your life, either socially or work or other important areas. And the last criteria is that it's not a preoccupation with weight only or body fat, because that would fall under an eating disorder, which could run next to body dysmorphia, but they are different.
What are some other considerations for mental health that we should be looking out for?
Well, I guess there are a bunch of things. First, the BDD or body dysmorphic disorder, it does run alongside depression. About 75% of people with BDD also have depression. So it really is a distressing condition. So to me, it makes sense that they go together. Looking for substance use, a lot of times that's a coping mechanism or way that people try to deal with their distress level of their self-esteem or these preoccupied defects. And then if we're talking about BDD specifically, it also runs with OCD, and it's actually in that same category in our diagnostic manual because the intrusive nature of these perceived defects. And then, of course, social anxiety, because it can really interfere with how you interact with other people if you're so focused with feeling that low self-esteem. So you mentioned earlier about how do you see the signs in people, in yourself or in other people. I think the biggest thing is how much time do you spend focusing on these things? And also, how is it affecting your life? Are you missing work and school because of it? You don't want to go to social events because of it, and that it's really causing an impairment.
Okay. I think us in the office, I would see it with patients who were coming back to fix something that they're showing us, and I don't see what they're talking about. You look absolutely perfect. What are you talking about? You look great.
They just want that little bit.
Right. And surgery is really a big solution for a small problem sometimes. So it really, looking at it from that perspective, it does make sense that other people would be like, even if they see the small little asymmetry or whatever it is, that surgery may not be the answer for it. And a lot of people do seek plastic surgery, dermatology, dental care when they have BDD, but most of them are not necessarily satisfied afterwards. So I think that would be another sign to look for, at least if you're practicing in medicine or if you have friends who have gotten cosmetic surgery done, that even once they have the surgery, they might feel good for a little bit, but 81% are actually dissatisfied. So they keep having that preoccupation no matter what they do.
They're never 100%.
Is it 81% of patients who have BDD who go have surgery? 81% of them are still unhappy.
81% of the people who've had the surgery. Who have
surgery, period.
Mm-hmm. Or no, who've like a surgery and they have BDD.
Oh, okay.
So 20%, I guess, are happy forever and maybe they were okay, but 80% of them are usually unhappy afterwards. So if you have BDD and you're going in to get surgery, there's an 80% chance that you're not going to be happy with your result.
And regardless who the surgeon is. Yeah, exactly.
Let me tell you guys, I know I'm seeing a lot of this. This probably is maybe not related, but I mean, it's something that I think we should talk about. These are hey, you guys, I want us to talk about the crap we should talk about. Like, let's not leave it unsaid. Let's talk about it. Like, one of those things is I had a patient consult the other day who had just had surgery not even 12 weeks ago. And she was already thinking about her second surgery for the same procedure. And it's just this, like, I mean, I had to talk her off the ledge. Like, hey, you're not even healed completely from this first one. And you're already thinking about round two. And I feel like there's a lot of talk about, oh yeah, round two, round three. Like, now I'm doing this. And it's very easy to get pulled into the, okay, if I don't get what I want the first time, then maybe the second time I'll get what I want. And I feel like it's a very slippery slope. Before you know it, you're going along and you're booking it and you're going to have another surgery and you haven't even gotten to really enjoy or like accept the new you, the new person that you are after your first surgery. And I want all of our listeners to take a step back before they go and plan a round two, before they're planning, to have more procedures. Like, let's take a step back and let's enjoy the procedures that we just had. Like, you just went through a whole recovery. Enjoy it. Get to know the new you, because I can tell y'all that after my surgery, I feel like I was getting to know myself again. And thank God, the round two didn't really come into my mind, but I feel like some of our patients or some of our listeners, women who are having plastic surgery, are not giving themselves the time to accept their new body, accept their new you, and also reflect on changes that it's going to have on you on the inside, like changes with your self-esteem and all of these things. It's like we're chasing something and then we get it, but now we're chasing it again.
Right.
So
it's like, I think you have to know your goals and expectations. That's a big thing. First, when you go in for your initial consultation, you have to be honest with yourself, with your surgeon, because if not, in the end, you're not going to be happy. And that surgeon is not going to be able to provide you with what you want if you don't express.
Right. Annalisa, when you have a patient come in, is there certain things that you see that you're like, okay, this one I need to keep an eye on?
Sure. Okay, so there's patients, it's a broad spectrum. One patient, they're going to be happy. They give me goals, expectations. I know exactly what they want. Then I have another patient that comes in and they tell me what they want, but when they come back in, it's completely different. They're never going to be happy, So that's the mental part that we as providers have to be open and honest with patients to help guide them, right, Nicole?
Right.
To figure out when's enough.
Mm-hmm.
What do you think?
Well, I think it really depends. You're saying at what point do you stop doing procedures for them, or?
Yes, because they're never going to be happy. Like they look perfect. They look great. So it's more body dysmorphia, but you don't want to put that label.
You know what? On those patients, for one, you know that if one plastic surgeon says no, they'll just find another one. So I think what we should, what I want to do is bring light to it. Like, hey, you guys, like this is actually something that could be happening, around you with somebody that that just doesn't seem satisfied with any of the surgeries that they have. Maybe this is a point where we can talk to them, send them this episode. Hey, maybe you should listen to this. Instead of letting it like, it's just something that happens. If they can't get it with one surgeon, they'll go somewhere else. Okay, yeah, I get it. But let's talk about it. Let's maybe try to catch them before they keep going. Let's try to catch them before they keep doing it.
Because I think the great surgeons, they're going to be, open and honest with the patients and say, hey, you know what? Your goals aren't realistic. We need to talk about something else, or this is another option, but the surgeons that are not ethical and they're just doing surgery just because that patient's never going to be happy.
If anything, it's kind of worrisome for someone to do that, not just from a moral perspective of doing unnecessary surgeries, but a lot of BDD patients who are unhappy, they are more likely to sue and be more aggressive.
Oh, yes. Yes, for sure. And it's like, wait, we talked about this in the initial evaluation.
Right. But still, I think it, like you said, Mavi, it is good to have an open conversation in case a friend has symptoms of this. It is hard for people to really catch it in themselves and realize that these distortions really are not, they do walk that realm of not reality or even delusional. And I don't want to call someone delusional and make it, invalidate them. But at the same time, they really might be distorting what's really there.
Yeah. And they might not have the access to the information, Right. It's the first time that they're hearing it.
Mm-hmm. I was just thinking that I think some people, especially younger people, like teenagers or young adults, maybe they didn't get the talk with their parents about plastic surgery. So they might go in thinking plastic surgery is an easy fix and more in a naive way, not realize how serious or intense of a solution it can be. So I'm glad that there are conservative surgeons out there who will just talk to them about it. It doesn't mean they have BDD because they want surgery for something. They just might not even know that it is more intense than they might even realize.
Absolutely.
Yeah, you don't know what you don't know. So
exactly.
And I think, with the podcast, what's the one thing that I keep saying over and over again is build a relationship with your plastic surgeon. Build you have to get to know them and they have to get to know you. And I've told y'all that they're interviewing you just as much as you're interviewing them, because these types of things pop up in those initial consultations. And I hate to say it, but that touch is lost in virtual consultations. That touch is lost when you're traveling to another state or another city. Like that plastic surgeon hasn't really gotten to know you. They haven't talked to you. You haven't sat in front of them, gone over your questions, gotten a feel of how they are. They haven't gotten a feel for you either. So I think with
COVID, it's been a little bit different, but at the same time, we've adjusted. But I agree with you 100%. There is nothing like an in-person consultation for sure.
Nothing. Absolutely nothing. So Dr. Nicole, I know Dr. Motakef, how does he handle these types of things in his practice?
So he does tend to be more conservative, and he's told me he has tried to talk people out of surgery more often than not. But more of a conservative, takes a conservative approach and really tries to avoid unnecessary surgeries, partly because of this, but also, it's just best for everyone, even the patient, even if you don't have BDD, but to not do things that you don't need. But to hear them out too, what they really want and what their goals might be. Maybe you go in thinking you want liposuction, but really what you need is a tummy tuck. So that's really a conversation that your surgeon can help point you in the direction to get the result you want, even if it might not be what you thought you wanted to get that result.
Right. So building that relationship, having those conversations, and letting your plastic surgeon guide you, of course, is, one of those things we keep saying, they know what they're doing. They know what's going to give you the best results. So always be open-minded to other procedures. If you have a problem area, like for example, your abdomen, most of the time, it's not just liposuction. Most of the time you probably need a tummy tuck too, but being open to that. And, even scars is something that I think really affects our mental health after surgery. Like we don't think about those things. The scars from a tummy tuck or a breast lift or a breast reduction or a brachioplasty where you have an incision from your underarm to your elbow, or a thigh lift where you have an incision on the inside of your thigh from your groin to almost to your knee. These are big surgeries and these are big scars that we definitely need to think about before we undergo these procedures.
I think that's a great point, and that might tie back into that teenage group of it's really important to talk to them about, like, if let's say they all of a sudden want plastic surgery because either they wanted it before or they see you getting it, so now their gears are turning, that it's important to talk about these negative sides that they need to be aware of, because it really isn't a quick fix, and it might cause other things that they're insecure about.
Here's a question, and it just popped in my mind. How do you treat body dysmorphic disorder?
Oh, yeah. That's a great question. I would say with younger kids, if you see it, therapy is a great place to start if they've never tried medications before and it's the first signs of any sort of mental health conditions that you're seeing. The one that's been studied the most is cognitive behavioral therapy, the one we talked about earlier, where you really look at where are your thoughts coming from and tracing them back. And really your thoughts have a huge impact on how you feel about yourself and how you view the world. That would be one place to start, but there are other types of therapies that can help too. So I would just get in touch with a mental health provider who can point you in the right direction of what might be the best option. There are medications too. The ones that have been studied the most are antidepressants, and they have the most benefit in this group, but nothing is approved by the FDA, mainly because they didn't do the studies for FDA approval. But there is research showing that these medications can be helpful.
Awesome. And before I let you go, hope I can pick your brain on how should we handle social media with our kids and, these fantasy lives that they see that they think is real.
Mavi, that's a broad question. True. That's like another 30 minutes. No, I'm just kidding.
True. We could talk a lot about that one. I need to think of, though, when you say that is there are a lot of positive social media accounts out there where they show you what they look like with a filter and without, what they look like when they're sucking in, and what they look like when they're, letting their abdomen just be soft. So
that's a perfect question. Sorry to cut you off, but I have patients come in and they'll show me a picture and say, I want to look like this. And I go, okay, I understand and I'm listening, but show me a picture without a filter. And I scroll. And I was like, there's no picture on that thread that you can show me without a filter.
Right.
So they're looking for something that's not realistic.
Exactly.
And it's crazy.
There is the American Academy of Child and Adolescent Psychiatry, and I believe the Pediatric Association also, they do have recommendations on social media general. I can send those over to you guys if you wanted to take a look at them.
Oh my goodness.
Yeah, we can add that for sure.
But I think in general, it really is case by case. It depends on your family and, your own values of relating to social media. But I think when it comes to this appearance aspect of it, really just focusing on how unreal it is.
Focusing on how unreal it is. And that, I mean, I've seen some before and afters, and not from any surgeons that I know or that I've been in contact with recently, but from surgeons in other countries where I'm like, this is very clearly photoshopped. You guys, this is not real. Like, this is not real.
This is not the end result. Yeah.
Right. Photoshop is too good these days.
Photoshop is going to be the end of me one of these days when I
they have apps for everything now. They have it for that too, where you can like alter your nose. You can alter anything.
Yeah. Facetune. You can Facetune.
Yeah, exactly.
To a perfect picture.
Yeah.
Nobody would be any wiser.
And I think it's just the girls thinking, this is perfection, going into their surgeon and saying, this is what I want. But the surgeon's going, that's not realistic based on what we're starting with.
Mm-hmm. Yeah. And even though it is good to talk about self-esteem and validate the feelings surrounding it, it's always also good to do pro-social things like helping your community and doing things that are just completely unrelated to how anyone looks, and really just trying to build a better world. And that really also has a good impact on our teens and kids.
Yeah. And I think us as advocates, it's important for us to be proactive to make sure that the younger generation, we're giving information that is realistic. And that's Bobby, why you have this podcast, so we can have good information coming out. The internet has so much stuff that is confusing, but we're here to give the biz. Right?
That's right. And you know what? I have an interview scheduled for later on this week with a plastic surgeon out of Seattle. And what we're going to talk about is the realistic results and the real longevity of these procedures, and how we need to think about those things. We need to think about how is this going to look in 10 years or in 15 years or in 20 years.
Yeah, because some patients come in and they're like, oh, this is going to be forever. I'm like, no procedure is forever. It's not forever. You have to reiterate that for sure.
Absolutely. One of those things that we're going to talk about in our next episode, but like y'all have heard me talk about how out of control my butt got when I gained weight after my surgery. And I don't think we talk about it enough. Like, you guys, we're getting fat grafted into our butts. If we gain weight.
Can I have some of these?
I would totally give you some if I could.
Sharing is caring, okay?
But that's going to be our next topic. Our next episode is actually about realistic expectations and how long are these results going to last. And
that's perfect.
I'm excited about that episode.
No, it's a good topic. I love it for sure.
Okay, Nicole.
Well, thank you, Dr. Nicole. Thank you for coming on. It's been great. Bobby, thank you again.
Thank you guys for joining me. And Dr. Nicole, I'm so excited to have you on. I hope we have you on again. We have so many topics we could talk about. Like,
yes.
We'll just pull one out of the air the next time you're ready to come on. But if our listeners want to reach out to you, how can they contact you?
Oh, that's a great question. So I just started my Instagram account for my private practice. It's MBLDN. So it's basically Embolden without the vowels. So Embolden Psych is my Instagram account and my website. So you can contact me through there, and I'm excited to start in July.
We're excited for you. We are excited for you.
Absolutely.
All right, you guys, that was the end of today's episode. I hope you found some value in what we had to share today. And if you have any thoughts, if you have anything we need to talk about, send it to me on Instagram. Dr. Nicole, I'm so happy to have you on. Annalisa, thank you for joining us again. And I'll see you guys next week. I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.